Hello, Dr. Das. Thank you so much for being with us today. Really appreciate you taking out the time.
Thank you.
Let's start off with a quick introduction about yourself, and maybe you could tell us a little bit about the University Hospital of Leicester's NHS Trust and the work that you do.
Yes, so my name's Dr. Indrajeet Das. I'm a consultant radiologist working in Leicester. My main special areas of interest are chest and cardiac radiology. And just about Leicester as such, the Leicester Hospital is one of the largest acute trusts in the country. We cater for a population of nearly 1 million around Leicestershire and Rutland region. We're also a major referral centre for respiratory, cardiovascular and renal services. And we're also a large research centre for cancer as well.
Could you tell me about your views about artificial intelligence and how has it changed over time?
So AI is, there's a huge revolution in radiology and AI at the moment, and it's a very exciting revolution. And I think the AI technology, I've seen it evolve quite significantly. I still think in Leicester, we're kind of at its infancy, but I think what I'd like to see is more research trials involving real-world evidence, which is what I'm very humbled to be part of working with the Qure team for the QXR product to see whether working such technology in the real world can make a significant difference in patients.
Dr. Das, can you tell me about the National Lung Cancer Optimal Pathway and how would it make a difference to the life of patients?
Yes, so lung cancer as a cancer has relatively poor outcome compared to other cancers. And one of the main reasons for this is late diagnosis. Patients present late and sometimes they have quite esoteric symptoms. So it's difficult for primary care physicians sometimes to make a diagnosis. Often the first imaging modality that they have is a chest X-ray. And the National Optimal Lung Cancer Pathway was designed specifically with the role of trying to reduce the time to diagnosis from a national average of 62 days to under 49 days. And one of the ways it emphasized that to be achieved was by ensuring any chest X-ray with suspected lung cancer was ideally reported within 24 hours, and a CT was performed and reported within 72 hours. So for radiology, this is quite a paradigm shift. But I feel with the help of good pathways and potentially artificial intelligence, we might be able to achieve those targets.
Dr. Das, from your early days of piloting Qure's QXR chest X-ray algorithm, what are some of the takeaways that you would have for us?
So we've done a retrospective analysis of Qure's QXR product on 1,000 or so chest X-rays that were performed at our trust retrospectively. And we found that the product had an excellent specificity and sensitivity, and certainly was good enough to use as a prioritization tool. In the group that we trialed, we had 10 cancers that were confirmed, of which the product identified 8 correctly in terms of the site and location. And so it did it much quicker had we had the technology than the time it took to actually report the X-rays in real life. So had we adopted the technology in real life, it could potentially have saved time to report the chest X-rays for these patients.
And what might it mean for patients and NHS in the long term?
So long term, I feel that products such as QXR and artificial intelligence algorithms that identify abnormalities can help prioritize the patients that have critically urgent findings and abnormal findings to be reported earlier when we're already have resource constraints within the NHS. So it allows us to essentially resource utilize what we have within our own capacity to be able to prioritize patients at need of urgent action and urgent reporting. In the long term, I feel that the potential of artificial intelligence is so much that I feel even as a second read, it can add value and quality and accuracy to the reporting. So over the long term, I feel that it will reduce I hope it has the potential, certainly, to reduce any significant misses or significant errors, and essentially provide a great support for the radiologist when they report.
Specifically for lung cancer, what does early detection translate to?
So one thing that has been identified as very important, specifically more so in lung cancer, is that early detection improves outcomes in patients. Because if we catch cancers at an early stage, then they are generally better treatable, more operable. And so technologies like QXR can potentially catch cancers at a much early stage. And so if we prioritize the reporting, the CT and the detection very early, then it means that these patients are likely to have better outcomes.
What are your views about Qure's QXR technology working for other conditions aside from lung cancer?
I think, I mean, the QXR product is quite comprehensive, but in Leicester in particular, we have a large TB service, tuberculosis service, and actually a product like this can help identify and detect tuberculosis early on chest X-rays, because it's a public health issue. So actually having a system that flags these things early for the radiologist to report can be extremely useful. And other areas as well, such as pneumothorax detection, or detection of any trauma injuries on chest X-rays. Those kind of abnormalities can be very useful, particularly for the emergency physician in identifying pathology quicker. And so I can see lots of uses of the technology above and beyond cancer.
What advice do you have for some of your other colleagues who might be a little skeptical about use of AI in radiology?
So I think the first thing I would say, so I'm not an artificial intelligence expert by any means, but I found it fascinating how artificial intelligence can be applied to the workflow and to solving improving patient care rather. And what I found is that the artificial intelligence softwares, they're not there to necessarily replace humans, and I think a lot of radiology colleagues worry about that. But actually, I kind of see it analogous to autonomous driving, in the sense that it's there to keep you in lane, to stop you from crashing, but ultimately a lot of the decision making will still be made by the human, because a lot of decision making is not just rational, it's also intuitive. And so I think that, but the value that the AI adds is really as a safety net to help improve detection, to help you from getting back in lane, if you like, to improve your driving skills, if you like. And I think those are the main things that I think will inevitably come. And I think AI softwares like QXR and many other softwares, I feel that they have tremendous potential even now in improving our own workflow and our accuracy in radiology.
So you are optimistic about the role of artificial intelligence?
Yes, I am, and I feel that if it's implemented with the appropriate governance, the appropriate data protection, and with sufficient research evidence, then actually in the future it could become the actual new standard of care for patients.
Dr. Das, it's been a pleasure speaking with you. Thank you so much for your time. Appreciate it.
Thank you very much.